hard to see someone you care about that much basically be treated like something in the way.
Diana Brown says her 85-year-old mother, Beverly Redmond, is beginning to get the treatment she needs at Abbotsford Regional Hospital, where she was admitted over a month ago with an infection. But it's been a long road getting there. She says Redmond was transferred to Maple Ridge Hospital, then back to Abbotsford, and waited days in the hallway on a stretcher before getting a room.
I was told all the patients in the hallway meet a certain criteria. So it's good she's in the hallway because it means she doesn't need as much attention as some people in the rooms. And I, I really honestly couldn't believe I was hearing that.
A statement from Fraser Health says, we have seen consistently high patient volumes at Abbotsford Regional Hospital, and at times we need to place some patients in an overflow space to optimize care delivery to all patients. This decision is made thoughtfully and once our staff have carefully triaged patients and taken into account their specific care needs. Andrew Longhurst is a health policy expert and says Abbotsford Hospital was originally built under capacity, without enough inpatient beds and too small to serve the community. He says in order to address patient overflow, British Columbians need to reduce the burden on the health system with things they can control.
Right now, the biggest thing that we have control over is reducing the spread of infectious diseases that contribute to hospitalizations and severe outcomes that make it more difficult for other patients to get the kind of acute care that they need.
Brown says her mother faced poor conditions, that her food tray in the hallway was often pushed out of the way and out of reach. She was rarely taken out of her stretcher to move around and not cleaned as often as she should have been. A similar story from a stage 4 cancer patient who told City News she was on one of more than a dozen stretchers that lined the hall, often with a lack of privacy, and had to help fellow patients with their food and water due to a lack of staff. She claims her sheets weren't clean throughout her stay. Fraser Health says it's concerned to hear that patients and their families have been dissatisfied with care and will implement necessary measures to improve the patient care experience.
I cannot relax and trust that she will be taken care of. I need to be on it every day. And I'll do that because I want her to get better.
In Vancouver, Kate Walker, City News.